All right.
Okay. Yep.
I didn't know if you're ready.
Right.
I'm Heidi Irwin. I'm a physical therapist at Metamora Physical Therapy, and this is Kathy Pepper. We just celebrated actually our 6th anniversary in January. I just wanted to give you a little bit information about us before we go into the osteoporosis. We're located in Metamora, like Dawn said. We're on 24 just south of Pratt Road and with Hungry Howie's, kind of by Bailey's where the old pickle barrel was. Like I said, we're both physical therapists. We have 2 other physical therapists there. Our services are outpatient physical therapy, so your general neck pain, back pain, knee pain. But Kathy and I both specialize in a few areas too. Kathy's our breast cancer rehab physical therapist, as well as our lymphedema certified physical therapist. And then we both specialize in pelvic health physical therapy, whether that's for men or women. We offer services such as dry needling, A-stim. We're also both post and prepartum, or postpartum and prepartum specialist. Anything else you want to add to that?
No, I think you covered most of
All right.
it. So yeah, that was good. Yeah.
She's going to begin the talk, and then I'll jump in a few minutes. The folder also, that's the other thing. We included the PowerPoint presentation in there, as well as your home exercise program that we'll go through a little bit more at the end. So go ahead.
Well, good morning, everyone. Once again, thanks for coming out and braving the cold and joining us for this presentation. So what we're going to talk today about is osteoporosis, kind of what the risk factors are, exactly what osteoporosis is, and then Heidi's going to come in and talk about kind of exercises and what physical therapy looks like as an intervention for osteoporosis. So we'll go ahead and jump right in here. Okay, so what is osteoporosis? So osteoporosis is a disease that thins and weakens the bones, and your bones become fragile, and when they're fragile, then they fracture easily. Your body constantly absorbs and replaces bone tissue. So this is, well, I'm going to get this started here. So with osteoporosis, the bone doesn't keep up with the old bone removal. So you have your bone and you have your marrow in it, and when your body needs calcium, it goes into your bone and it takes it out so your body can use it. And your body naturally goes ahead and puts that calcium and bone back in and replaces it. With osteoporosis, it doesn't keep up with that removal, and so then it gets porous and then it fractures easily. So, so your bones start degenerating, you lose the required density of the bone, and osteoporosis literally means porous bones, so that's kind of what an osteoporotic bone looks like. So there is over 3 million new cases reported a year in the United States. Most people don't have any symptoms of osteoporosis until they experience a fracture. So the most common areas where you get osteoporosis in the body are your hips, your spine, and your wrists. So as you can see, if you know your hips, your wrists, when you fall, that's usually what you do on an outstretched arm. Your wrist becomes fractured, your hip becomes fractured. So, all right. So who gets osteoporosis? 200 million people have osteoporosis throughout the world. 3 million new cases are reported in the United States yearly. So 1 in 5 adults in the world may have osteoporosis. But the good news is that only 30% of those will experience an osteoporotic bone fracture. Women are 4 times more likely than men to get osteoporosis. And then after the age of 50, 1 in 2 of them people will have osteoporosis-related fractures in a lifetime. So that's pretty staggering, to have that many people be affected by it. There's another 30% who have low bone density that puts them at risk for osteoporosis, and that's the really early on stages of osteoporosis, and it's called osteopenia. So you might hear that terminology as well. So osteoporosis is responsible for 3 million fractures a year. 300,000 of those are the hip fractures, because that's one of the main areas where the osteoporosis happens. And of those 300,000, 20% of those will die within a year of their fracture. And those that do survive, only half of them will live independently. So The other 50% will live in a nursing home or require some sort of assisted device. So really important to really start looking at those things because it really becomes a serious issue once you start getting into those fractures. Okay. All right, so the early warning signs of osteoporosis, some of those receding gum lines because of your jaw and the bone starts breaking down, and so you'll see those receding gum lines. You'll have some decreased grip strength because it affects those wrist bones as well. You can have cramps and bone pain. Obviously, a fracture is a pretty big warning sign of that. People always talk about a loss of height. You go to the doctor and I shrunk a couple inches. Well, that's because that bone starts weakening and breaking down. Brittle fingernails as well. And then that widow's hump or a dowager's hump. So you'll see that up in that upper back here where you're starting to get rounded here, and you kind of see that hump in that upper part of your back as well. Okay, so did that go to the right one? I think so. So things you can control with that are your eating habits. So calcium, getting the required amount of calcium, and that's recommended to get 1,200 milligrams before menopause daily, 1,500 milligrams after menopause. And protein. Protein's an important part as well. And they should say you should have half your body weight in grams of protein daily. And then making sure you're getting your appropriate vitamin D because that helps with that calcium absorption. And the recommended is 800 IUs daily. And I've seen it up to more than that on a daily basis for your vitamin D. So I would say that was probably at the minimum is your 800 IUs daily. Making sure you're keeping an active lifestyle. A sedentary lifestyle increases the risk for your osteoporosis as well. Osteoporosis responds to exercises, to weight bearing that helps your body and your bone reabsorb that calcium. So staying active is really important to help combat the effects of the osteoporosis. Tobacco use interferes with that absorption of the calcium and bone regeneration as well. So that increases your risk if you use tobacco and alcohol as well. So 2 or more drinks a day increases your risk for osteoporosis. Yes?
Does it matter if you get vitamin D3? Because I can't find just plain vitamin D. Because they told me to start taking that D, but I can't find just plain D. It's all D3. Does that matter? D3?
So the question, and I'll repeat it here, was does it matter if it's vitamin D3 or just plain vitamin D? Heidi, do you have any ideas?
That's kind of more, there's actually a local pharmacist in town who we refer our patients to for those types of situations. I think she carries vitamin D3 too, but as a physical therapist, we don't get into that as much in terms of what vitamin to use, unfortunately. It's a little bit out of our scope of practice. So we do refer to a place in town.
So I should ask her.
Yeah, at Apothecary and,
Does it matter?
yeah, I would ask Hillary Howell at Apothecary and Company. She's right, yep. Mm-hmm. She's our go-to.
Okay, you're welcome. Yeah. Okay. Okay. We'll go from here. So then, how is osteoporosis diagnosed? There's 2 different types of tests that they run. One is called a bone density test or a DECA scan, and that is where they take x-rays to determine your bone density with that. And they usually take it at the spine, hip, and wrist are the areas that are scanned, and then they score it in what they call T-scores. And that kind of determines what your risk is. So a T-score, it can have anywhere from -1 or higher, and that would be considered normal. A -1 to a -2.5 is an increased risk for that osteoporosis, and then anything -2.5 or lower is osteoporosis. Another thing that they might do is a bone scan, and that's where they inject a small amount of that radioactive material, and it tells you how your bones are absorbing that material there. And that's used to detect fractures as well as cancers or infections in the bone. So the treatment of osteoporosis, we kind of touched on a little bit of that. Medical management, there's all kinds of new medications that are out now for that, done through supplements, through vitamin C, calcium. They talk about the vitamin D and magnesium. Exercise, which we do as physical therapists, and that's what Heidi's going to talk about next. And then your diet as well. So there's a lot of good forms of calcium you can get through your diet. Things such as salmon, sardines, broccoli, some of your fortified juices, and dried figs are a really good source for calcium as well. Yes?
When you say a fortified juice, what are you looking for in that type of a juice?
So, you know, things that are supplemented with calcium and your vitamin D. Yes, we have those supplements in there. Yeah.
Added calcium, I got you.
Yep. There you go. Okay. Heidi's up. Did I miss one?
A
Did I-
risk factor slide.
Oh.
So let me see if I can go back quickly.
I felt that maybe jumped over.
Yeah,
Or maybe it went over a
it
couple
jumped
of them.
over one.
Ah.
Okay, let me
Do you
go
wanna
back to
over
that.
Are you
Oh gosh, that looks,
good? There was a lot of information on that one.
yeah, okay. All right. So just a real quick recap on the risk factors. They goes through ethnicity here at the top. So white American, 9% risk factor. Mexican American, 13. Black American, 4.2. So again, kind of your composite dictates your risk factor. Your body weight, having weighing less than 127 pounds or having a body mass index under 21 is a risk factor for osteoporosis. And then if you lose weight during the menopausal transition, you're more likely to lose bone too, and we're going to talk about that in a second. Medical history, so overactive thyroid, parathyroid issues, adrenal gland issues will put you more at risk. A history of a bariatric surgery or organ transplant, hormone treatment for breast or prostate cancer, or a history of missed periods. If you, any cancer treatment with which the women has a lower estrogen level can increase the risk of osteoporosis. That includes chemo during early menopause and radiotherapy to the ovaries early on. Celiac disease, inflammatory bowel disease, multiple myeloma, and that's a pretty high rate. 90% of patients with multiple myeloma will develop bone disease. And then medications, excessive or long history of steroids, breast cancer meds, and seizure medications. All right, let's go back to exercise now. Okay, and like Kathy said, this is what we do as physical therapists. We are your exercise gurus. And this is slide number 10 if you guys are flipping through. And let me get back to mine. All right. So when you exercise, bone responds to exercise by getting stronger, just like your muscles do. So if you exercise your muscles, they will hypertrophy. They will get bigger. Bone will do the same thing. It will lay down more bone and it will produce a stronger bone. So generally speaking, the more you exercise, the greater your bone density. I think one of the biggest myths that we hear, or the people say in the clinic, is that they're, have osteoporosis or osteopenia, and they shouldn't be exercising. They're very scared that they will fracture, and that's untrue. Especially lifting weights. Lifting weights is very good for the bone. It stresses the bone in a good way. So about bone density, you peak in your 30s. We're all past that. And then we begin to decline. So we're declining as we sit here right now. We lose 1% of our bone mass every year from 30 to menopause. After that, 2% each year. By 60, we've lost 30% of our bones. That's kind of a high amount of money, or a high amount of bone. It's advantageous to be active earlier in life so that you can get a head start on this, but it's never too late. So postmenopausal women, they can start their physical activity with some of these things here. This is helpful so all your exercise is helpful to increase your muscle strength, improve your balance, decrease your risk of bone fracture and falls, maintain or improve your posture, or relieve or decrease pain. All right. So when you are exercising, we want to be aware of what our spine is doing. A lot of bending and twisting can be problematic for the spine if you're osteoporotic. So we want to avoid some of these activities. Abdominal crunches, so just laying on the floor and crunching. A lot of people tend to go to that one as their main core strengthening exercise. Not the best choice for someone with osteoporosis. Curl up's kind of the same thing. You're just coming up further. Oblique rotations, where you're laying on your back and rotating. Golfing. A lot of people are avid golfers. Some of that, depending on your risk, may need to be avoided. Yoga poses, the pigeon pose is one of the ones that come to mind here. That really does stress the spine. So some of those things need to be avoided. Some other things on a daily basis when you're doing things around the house with, lifting, tying your shoes, backing up your car, making your bed, you always want to keep a straight spine. So for example, the backing up the car one, you're looking over your shoulder to back out of your driveway, but we tend to kind of slump when we sit and look, and so that forward posture and rotation is not great for the spine. You always want to keep the spine nice and elongated, and then rotate if you have to do some of these activities. Hip protection. So we'll talk about this in a second. It's always good to improve your balance. You can improve your balance until you leave this fine earth. So some of the things you can do, I do it at the bus stop. It's very weird, I'm sure, but my son will get on, he's 8, and I'll stand there on one leg. I'm sure the people that drive by think I'm crazy, but you have to fit it in during your day. Most people don't work on their balance. It's one thing they neglect. So working it into your day while you're brushing your teeth, if you're standing in line at the grocery store, maybe you put your one foot in front of the other and you balance there. It doesn't matter when you do it, it's just that it's necessary to help decrease your fall risk. And then wrist protection. Again, Kathy mentioned, when you fall, the first thing that comes out is your arm. You want to stop the fall, but then you end up fracturing a wrist. So a lot of times we will give you on your hands and knees, and you just kind of put weight through the wrists so that you can start weight bearing on those wrists, and that builds bone. So the four categories you want to focus on when you're thinking about exercise. A lot of people will hit maybe one of these, but a lot of times you don't see people working on strength training, weight bearing aerobic activities, flexibility, and balance. So you really have to hit every category to get the most bang for your buck. All right, so let's talk about weight-bearing aerobic activities. The examples of that are walking, dancing, a very low-impact aerobics, elliptical, stair climbing, gardening. Those would all work for your aerobic component. The ones you want to, if you go down further, kind of stay away from in terms of lacking the necessary weight bearing is swimming and cycling. Those are great for your cardiovascular system, and if it's something you like to do, do it, but understand that it's not classified as weight bearing, which you need for the aerobic component. You can run, you can jump rope, but again, it's all about risk reward in that scenario. These exercises work on the bones, specifically legs, hips, lower spine to slow your mineral loss. They provide cardiovascular benefits, which boost your heart and circulatory system, and just overall health. Again, it mentions not to skip on the other three, the flexibility, balance, and weight or strength training. So into strength training, we can include free weights, resistant bands, so like your TheraBands you see at physical therapy places. It seems like everybody has some of those around their house, to improve our muscle mass. Even to use your own body weight during a squat can improve your muscle mass and your bone loss. Resistance training is there too, again, promoting muscle and bone growth. Weight machines are probably one that, with a lot of them, we kind of disagree on. A lot of people go into your to your different facilities, and there's a lot of weight machines, and a lot of them are for the core strength, like a crunch machine, a spinal extension machine, the rotating one where you sit. So a lot of those are sitting, not good posture, and then bending. And again, they're not weight bearing. So you're really not getting a lot of reward out of those. There's probably more risk associated with those. But they tend to be kind of the easier choice because we don't have to think about, what do we have to do? What kind of weights do we have to get? So just beware of that. The resistance training should be tailored to you. Everybody comes in with a different set of comorbidities, health challenges, past histories. So really, if you don't know where to start, it's always important to go to physical therapy, get a personal trainer so that they can guide you. In most cases, physical therapy is covered by your medical insurance, and a lot of times we see people in the clinic for just balance loss and strengthening. So it doesn't have to be something more specific than that. All right, so balance. Let's just stop and take a second, and if you would like and you feel comfortable, let's all stand up. And be kind of by your chair so that you have something to hold on to. I will say with balance activities, it's always interesting one that most people don't know like what kind of balance they have. They don't know if they can stand on one foot. They don't know what happens when their eyes are closed. They don't know, if they're on the grass, are they more unsteady versus on a floor like this? So that's the first thing you want to kind of just check is see where you are. So let's start with something easy, like just put your feet together and see if you can let go and drop your arms by your side or cross your arms over the chest and kind of how you feel there. Most people are pretty solid here, but it's good to know about yourself because then you have a baseline. The next one I would do is I would take your right foot and put it in front of your left foot. And if you can't, you can modify by kind of staggering it. So some people cannot stand like this. They'll fall out of it, they'll get shaky, they'll lose their balance here, okay? To make this one harder at home, again, you can cross your arms over your chest. You can also, not right now, but you can stand on something uneven like a cushion off your couch. You can even turn your head side to side, and that will, again, train your balance, okay? And then you can switch sides at home. The last one I would try, and I would hold on first, is a single leg, just standing on one leg and seeing what that feels like. One leg is usually better than the other leg. If you're unsteady there, it still helps to put one finger on your kitchen counter. It still will help improve your balance. And then there's ways to make that more challenging too. So usually the rule of thumb for kind of a single leg balance on each side is 30 seconds to a minute. You should be able to hold that. So just something to consider when you're working on those activities. All right, you can sit back down. Do you have something to add?
Yeah, just, too, so, you guys are doing this all, with your, I should probably stand up here, with your eyes open, right? And you think about too, even, once those get easy for you and you have your feet together, try to close your eyes because that really makes you challenge your other parts of your balance system. And your vision is one part of it. And when you take that vision out, it really challenges your joints to kick in and your vestibular system to kick in. And so if you think about, you get up in the middle of the night to go to the bathroom, you don't have that vision, right? So, it's important to take it to the next step too and going through all those positions that Heidi was just talking about, but then see if you can do it with your eyes closed, but making sure you do that in a really safe environment too, because you'll be surprised how quickly that changes how you feel when you do that. So having a chair behind you that you can, like if you lose your balance, you can fall into the chair behind you or the couch behind you when you do those things too, so.
Yeah, the vision is a big necessity for people. It's usually one of the highest reliable parts of balance, and we're always very dependable on our vision. So when you take it out, it really does change your environment. So the next time you get up to go to the bathroom at night, turn the lights on. Whether you're worried about waking someone up or not, it's really important to keep you safe. All right. So here, that leads right into this. I didn't even look at it actually. Preventing falls in the home, clutter-free home. We have a lot of patients who have had multiple falls and they have throw rugs, everywhere. And if they have an assistive device like a walker or a cane, they're getting stuck on those throw rugs. So we always encourage them to declutter. Good lighting, again, like I mentioned, especially at night, that makes a big difference. Turn on the bathroom light, turn on the hallway light. It does help to get to the bathroom safer. Grab bars. When you get to the point where you need assistance, grab bars in the bathroom are important. In the shower, around the toilet, etc. And then shoes. You don't want to be in the house on slippery floors without some kind of nice soled shoe. So today's a good example of this. The salt is not working out there, and it's very icy and it's very cold. So we have to be mindful of just our environment when we're outside. A lot of people will look down to see where they're stepping. That kind of can fall into like look down, fall down scenario. So, you have peripheral vision, so you kind of just gaze the area. You don't want to be walking down and setting your feet. You want to kind of look around. You can see the ground, you can see down, you can see what's in front of you. So in terms of slopes, inclines, walking on grass, dirt roads, etc., you just want to be mindful of that. All right, here are the exercise guidelines. So, always consult your physician before starting any exercise program. According to the Surgeon General, we all should be exercising 5 days a week minimum for 30 minutes. Best to do it 7 days. If you're starting out a new exercise, again, we offered that before, working with a therapist or personal trainer. You want to start with light weights. Sometimes body weight is just enough until you get stronger, and low repetitions. And then know what you are coming in with it. So if you have fractures from osteoporosis, it's more important for you to make sure that someone's guiding you with what choices you're making in terms of exercise. So if you go into your folder, there are a group of exercises. Like an extra copy. And so this is just kind of a sample of, yes, that's what it is right there. I'll get one here. I didn't bring one up with me. This is a sample program that you can start with. So we were very, again, kind of mindful on which ones we chose. We tried to throw in some flexibility exercises, some strengthening, and some balance exercises. Of course, the aerobic training we've went through. So this is, if you're looking, everybody find that. It's a couple pages here. The first one here is a doorway stretch. The doorway stretch is easy. You have to have a doorway. That's all it requires, so you don't have any excuses there. Everybody has a doorway. It stretches out the chest area. It helps from kind of getting into this forward posture, and it actually feels good. It's one of the better stretches, in my opinion. The rows and the next ones are rows. So again, we're working on postural stabilizers back here, which again help you stay erect, good posture. Next one kind of just gives you a little bit of some mobility through the upper spine, which a lot of people need. And then we get into our balance ones. So you have the single leg balance, what they call the tandem balance, which we tried earlier, down to squats, more rows. And then finally on the last page, again, more spine erector muscle builders. The sets and reps we did include on the column next to each exercise. So you have a guideline of where you can start with some of these exercises. Most stretches are 30 seconds, 3 times in a row. And then in terms of strengthening, we set those appropriately. Any questions on the exercises? Yes.
The last How would you do this at your house? Kind of looks like that.
The bands.
Yeah.
You would have to have a band. So you can buy, the question was on the last page of the exercises, how would you do, one of them was pulling down bands and the other was pulling across like this with a band. You would have to have a band. You can get them they're very cheap on Amazon, Dunham's if you don't use the internet. You just need one. They come in different sizes, or strengths, sorry. Usually yellow is your easiest, depending, every company's different. Black or gray is the hardest. So most of these exercises, you're gonna start probably with a yellow or a red. Did you have something to add? Oh, sorry, I thought you raised your hand. So yellow or red are probably most appropriate for some of these ones that you see with the bands on this routine. Any other questions about the exercises?
So it looks like most of these are like for stretching and balance.
And strengthening. So the band ones are your strengthening. The squat is strengthening.
Okay.
Yeah.
Those are the 3 areas you were talking
Yes. So we kind of just mixed in a few of each one, so you had kind of just a little starting point. And then you would have to add like your walking or your, elliptical, your aerobic component to that. Good questions. Yes.
Do you guys offer any, like if I was to come in just to do a general assessment,
Mm-hmm.
and then if you felt that we needed to have PT,
Mm-hmm.
do you refer us to go back to see our doctor
Mm-hmm.
so that we can get a script for therapy, or if we have insurance
Sure.
or not?
Okay. So I missed your question, but this question was, do we offer any kind of services that you can come in and kind of be guided on what you should do next? Should you, would you recommend PT? Would you recommend seeing a doctor? Do you need further imaging? And we do that. We do free injury screens. All 4 of us at the clinic do those. They're 30 minutes. You schedule those. You come in. We do a examination. Listen to your subjective history on what you think is going on, and then we do make recommendations. Follow up with primary care. I don't know. You may need some X-rays in this case. Maybe you need to see an orthopedic. What other suggestions? Physical. Sometimes just a couple exercises we can give you, and you work on your own a little bit too. So that's an option. But yes, we definitely have that option in our clinic, and you just give us a ring and come in. In the state of Michigan, we can treat you without a script. It just gets fuzzy with the insurance. Certain insurances allow it, certain insurances don't. With Medicare, we do have to have a script from a doctor, a dentist, MDDO, nurse practitioner, PA. Did I cover all of them? And so then you can come in and we can get you started after that with physical therapy.
How often do you recommend like getting that X-ray of your bones? And have you ever
Oh, the
heard
DEXA.
anybody come back after they've done a lot of exercise and seen an improvement in the X-ray?
Yeah, I actually just had a recent patient, maybe a few months ago, that she wasn't coming to us, but she is osteoporotic, and she had the DEXA scan, and she was trying to avoid meds. She didn't want to be put on medication. She had a pretty severe score, and they really wanted her to start medications for it, and she just chose some of the medications. She just did not want to do it. She was against medication, and so that was fine, and she chose to exercise, and she did see some improvements. Now, I don't remember the exact number. They still wanted her to go on medication, of course, but she was a severe case. Do you have anything to add to that?
Yeah, I mean, and you do, and it takes consistency, right? Just like anything that you want to see improvements in. But yes, I have seen patients as well too, and that's like kind of their main goal with some of them is they want to come in, they want to avoid those medications, and they do see improvements. And if not improvements, they definitely see a stop in the decline of their status, especially when they have that osteopenia. And so whether it's in through exercise and they stay through with a regular physical therapy exercise program, whether it's through Pilates. We offer Pilates at the clinic as well, and that's a good thing to work on your spine as well. And then doing just a functional fitness class, which we're offering it as well. And that kind of really just gives you some consistency to do that. And that's kind of where we focus in on. So yeah, it is possible to stop that progression of that osteoporosis. So.
Yeah, and our classes are very small because it's, and they're taught by me and Kathy, and so we can modify. And of course, we wouldn't, if we knew you had osteoporosis or penia risk, we take out kind of those exercises that might not apply or be safe for you. Yes.
I'm almost living proof of that. Yeah, but I don't know if there was exercise, but I went in, let's say December of 2020, and they said you have osteoporosis, and I got put on Boniva. I told Heidi about this before. And then my back hurt terribly, awful. I had to go to physical therapy, and I didn't see any improvement, but it ended up being the medication. I went off the medication, the Boniva medication, and it took, 2-3 months or something, but then my back pain went away. I got another test, at the end of December that year, and they go, oh, you're cured. You don't have osteoporosis anymore. So,
Doing
Yeah.
exercising?
yeah, I don't really know if it was a faulty test for the first part, or if just a little bit of help. But that was going to be one of my questions. Can you cure yourself?
I mean, I think it depends on probably how extreme your scores are. I think like she said, the osteopenia, definitely you can manage that. And it just depends. I think your more severe ones, like the lady I was talking about, that's a little harder to manage, probably without a little bit of, medication at that point. She was pretty severe. She had fractures already as well. So it just really depends on where you are on the spectrum. But again, the exercise is never going to, hurt anything if you're doing it safely. And there's so many positive effects from exercise in general for other aspects of your health.
I'd like to just ask more a little bit about the functional exercise class.
Yes.
Now, my problem is that I've had osteoporosis for years. I've been on Fosamax. I'm actually off because I've been on it almost 5 years. I also have a lot of, I have a fusion L2 to L5. I've got cervical fusions. So my problem really is trying to find, I'd like to attend some classes. I'm very cautious because it has hurt me in the past. I've been dealing with this for a number of years. So my question is basically, what I need is a class where somebody understands my bone structure and what's going on with me, and then can recommend exercises. I can go in and try any class, but I guarantee you I'm gonna be sorry about that. It's not a good decision for me. So I was wondering, do you offer anything like that? You talked about a 30-minute evaluation, recommend what class maybe I should do. Orange Therapy just opened up over there, and I was all gung-ho. I'm like, oh, I can go there. And then I started looking at it, and I'm like, wait a minute, that looks too aggressive. It's way too aggressive for me. So.
Yeah. And I'll have Heidi talk about that as far as with her functional exercise class.
Yeah, I teach the functional. So the question was, does our functional exercise class with, other comorbidities like fusions on certain medications, a history of not doing well with exercise classes in general, what can we do in a functional exercise class, or what the recommendation is? I teach our functional exercise class. I keep it to 5 or 6 people. I don't take more than that because I have them fill out a history of what's going on. A lot of them have been patients, so maybe I've already seen them for something, so I'm already aware that maybe they do have a lumbar fusion, and these exercises we shouldn't do. Or, there's so many exercises out there, you can really modify a whole class off one person and everybody can still have benefit. So, in terms of for you and things, you probably, you'd have to go slower, there'd have to be modifications. But with that small exercise group, I can walk around and do that really easily. I can also see if you're doing something that you should be doing, but you're doing it incorrectly. I can walk around, put my hands on you, and change that posture or change that motion or what have you. So that's easy because it's so tiny of a class that it's right in front of you. You can see everything.
That sounds appealing.
So, yeah, and so then as far as the other part, if you didn't want to do the exercise, if you came in for an injury screen, of course we could look at everything. and see, where your deficits are and what things would be specific to you to make improvements, whether it be in flexibility, strength, balance, what have you. So that's another option. The third option that would come to mind is like finding somebody that would personal train you that's really good at what they do. I mean, we offer personal training in our clinic with Kathy and I. But then that way, maybe you do 4 weeks of that. You get, you get a good program. You know what you can do, what's affecting you, what isn't affecting you, and then maybe you go into the class, with a little momentum. So those are just some things that come to mind.
Yeah.
And I'd find more out about that by going on the website or calling?
You can call us,
Yep.
yeah. And if you have questions, like if anybody has any questions, we're very accessible at the
Yeah.
clinic. I mean, if we're with a patient, we would call you back, but we get a lot of phone calls, texts, private messages. So we're pretty accessible. So if you have any questions about anything after
Yeah.
today, feel free to reach out to one of us.
Absolutely.
It really sounds, that would sound very, like that would be something that I would want to, and that would be a road I'd want to go down.
Okay, good.
Yeah.
That sounds wonderful.
I have a question along the
Sure.
same lines. I've had osteoporosis for years, and pretty severe, but I haven't had any fractures or anything. So this functional fitness, is that something where I could go to the doctor, get a script, and my Medicare will pay for it? It's not my.
No, the Silver Sneakers program, right,
I know
is on most people's insurances. We tried to participate when we
We
first
did.
opened, and they were not open to new providers in the area. And so we were unable to do that. I think we looked into it twice, and we were told no. But yeah, so it is an out of cost.
It's a decision that I can
Yes.
make, and then
Mhm.
do you have these classes where they last like 4 weeks, 6 weeks?
Usually 6 weeks. Our classes are a 6-week structure. They're our class. And again, we don't, we're not a big gym, so we're only offering these like once a week. We're not offering them 5 times a week, 6, because we're carrying a patient load as well. But we do try to put them at a good time, or if we know there's interest and everybody likes morning, we'll shoot for a morning. So we do have some ability to kind of change that, but yeah. Yeah, go ahead.
Waking up in the morning, I'm sure a lot of people, I'm very stiff, especially my back. There are certain things, like you said, what can I do before I actually get out of bed to kind of loosen that up? Or
Well, you said you're on medication for osteoporosis. You just, okay. Okay. So I would say in that case, you can add to it, I would want to assess you, right? And I'd like to know your medical history. How bad is it? Where is it? What are your DEXA scans? Before I said, okay, you should do X, Y, and Z, and maybe that makes you worse. And then just that speaking, also like what kind of low back pain do you have? Do you have stenosis? Do you have a disc issue? So they all respond to different stretching, different strengthening techniques. So I would hate to just like say here and then have you have a poor experience with it. Yeah. Yeah. Oh.
I have one more question that you're going to think I'm calling crazy, but I like to stay active. And the big thing right now is pickleball.
I know.
And everyone's saying, come on, is that a good idea?
Is pickleball a good idea?
You're doing a lot of twisting, aren't you?
Yeah, again, I think it's an individual health, like medical history decision, kind of like the same with like the running slide. Like you can run and jump rope with osteoporosis, but like, is that, I always like to do, okay, risk reward. So is the reward of pickleball better than the risk, or is it vice versa for you? I think that's a fair assessment on some of these activities, not even if you weren't coming with, the health challenges that you have.
So maybe
Anything?
I would come to you guys, give them an assessment, and that would help me make decisions.
Correct. We could give you a little bit more information, and it would be more tailored to you. Yes?
What's the out-of-pocket cost for your class?
They're 6 weeks. They're $15 a class, so $90. 15. So it's $90 for the 6-week class. Yeah. So 15. Oh, sorry. Any other questions?
When are they
So right now, my functional fitness class is only Friday mornings from 8 to 9. Kathy has Pilates going on Monday nights.
Monday nights from 5:30 to 6:30.
And then we do have a yoga class. We don't teach that. That's on Tuesday evenings from 6 or 5:30 to, no, what is it?
5:30 to like 6:45.
Yeah, it's an hour and 15 minutes, and
Yeah.
it's kind of like a slow flow.
I had a nutritional question. I'm dealing with calcium, and vitamin D. What is your opinion on drinking milk? Because I've been reading a couple of books about, and articles about how we shouldn't be, consuming cow milk.
Once again,
It's a
that's a
big
hard,
debate.
it is. And, kind of depending on what you read, and same thing, you read different things. And, and once again, that's not our expertise as physical therapists, it's on the nutrition side of things. So once again, I would refer that out to somebody who's a registered dietitian. So
We do work with a registered dietitian up in Lapeer. She's very good, so if you want that information. There's not a lot of registered dietitians in the area. So
No.
we do have someone that we use in Lapeer for those types of questions. But yeah, it depends too, not even on osteoporosis and like drinking cow's milk, like what your diet is. Like if you're a vegan, if you're, it's a hot topic.
yeah.
It's a hot topic. Anything else? Well, you guys have been a wonderful group, like great questions. We appreciate your time and coming in the snow and everything
thank
else.
you.
So thank you.